Great. I'm Heather Deese. I am the HPV co-chair, HPV Task Force co-chair with Jenny. I recently just left my HPV nurse job. However, I was the HPV program nurse for the Alliance for HPV Free Colorado. And now I moved into more of a COVID research nurse role. However, I'm sticking around with Jenny because HPV cancer prevention is really, really important to me, and we are in this together. And Jenny and I have some great ideas for the next year, and so just happy to still be around.
Hi, everybody. I'm Jenny, and like Heather said, I'm the other co-chair for the HPV Vaccination Task Force, and I actually am a dental hygienist for my background, but I work at the Colorado Department of Public Health and Environment in their oral health unit, and I'm the oral health workforce coordinator.
Heather, are you talking? Who's got the next slide?
I can take this one. So we came up with our why statement. So why would you want to join our HPV vaccination task force? Well, I think everyone should join the HPV vaccination task force because almost everyone has probably had HPV in their life, and you all have, everyone has been affected by HPV. That's my personal why right now. But we did this exercise and we came up with this statement right here. Why join the HPV vaccination task force? And that's to an opportunity to engage in a statewide multidisciplinary collaborative to improve systems and disseminate best practices to prevent HPV in Colorado. Jenny, do you have anything to add about why you would want people to join the task force?
No, that was a great summary. I think when we go over our specific goals, it really hits home a lot of the whys or what's in it for me. So maybe we could go to the next slide. Thought that might be the one that was up next, so I'm glad I guessed right.
Yeah.
So the HPV task force has really been thinking through what our goals are and kind of where we want to see the task force go, not just within the next year, but as we pick up momentum, as we grow. And I think a part of, why I think it's important to be a part of the statewide task force is really to promote this, collaborative opportunity that we have. Like Heather said, a lot of people are impacted by HPV, and a lot of different health professionals, a lot of different advocates and health promoters could really help carry this, the mission of our task force forward to prevent HPV infection and promote HPV vaccination. And so from a dental perspective, HPV and its relationship with oropharyngeal cancer. And one of our goals, not only to recruit new members, but one of our goals is to really provide education, professional development opportunities for our task force members, as well as support the community-based efforts and approaches of the task force members that are working in their local communities for HPV vaccination, education, promotion, and the prevention of cancers associated with HPV.
Any questions on these goals or priorities? Great, we are here to support as well. So if you guys know of anybody who has these types of events happening, or if you know something, I know the community-based education and awareness events are at a minimum right now, just due to the current COVID environment. However, any sort of web-based activities, Jenny and I would love to know about how we can support you. We can go to the next slide. So Our task force meeting information is here, and you can always email Jenny or myself, and we're happy to add you to our calendar invite. But it's a recurring monthly meeting. It happens on the first Thursday of each month from 9 to 10 a.m. And this is our email address right here. I can also throw my Gmail in the chat as well, just in case something gets missed or you need to get a hold of us. But yeah, email us if you'd like to learn more. Any questions? Jenny, do you have anything to add?
I want to highlight a collaboration that happened a few years ago it's just fun to remember that it happened. And Ian mentioned this the other day, but the CDPHE and the coalition came together to do the Someone You Love screenings, as well as some motivational interviewing. So they did a road trip to show the screening across Colorado, and then on the next day, either before or after, they would have an MI training. And with the screening, they would also do a Q&A panel. Ian, were there any other partners involved in that collaboration?
I
can't
remember either.
I'm sure it was with Denver Health, right?
I think it was the Alliance.
The Alliance, yeah.
Yeah, I think it was, and there was some sort of mini grant, correct, that they had to do the MI road shows, and which was really was great. And you know, Jenny and I had talked about doing something to supplement the Alliance right before COVID hit, but no, we can't do any road shows. But yeah, thanks for mentioning that, Christy. And then the other night, Ian was so nice enough to invite me to Gladys's screening of Someone You Love. I was able to be a panelist on that small event. I think it was on like a Friday night. It seems like a year ago now, but it was just like a couple weeks ago. But that was really great. I think there were a lot of young people on that call, and from what I'm understanding, and I think that was just really great for young folks to see this documentary. And if you haven't seen it yet, I highly encourage you all on this Zoom call to watch it, Someone You Love. And it's really primarily focuses on, or it does, on cervical cancer. And I would really, just encourage you guys to watch it and have your friends, your family watch it. It just highlights some really, really inspiring and sad stories about people who had cancer caused by HPV virus. So it's really eye-opening, and I hadn't seen it in a long time. And before Ian dropped off a DVD for me, I was in my living room watching it again and kind of remembering all of these things. And my husband walks in, he's like, "Are you okay?" Like, not now. But we had a good event, and we had a slide up that was, some past successes and whatnot. Jenny and I have been really working hard this year to onboard ourselves as co-chairs to the HPV Vaccination Task Force. There was a little bit of a transition, and really kind of tidy up some of our goals and our distribution lists and whatnot, and see where we wanted to focus on. And I'm really excited for our goals for the next year. Even though we can't do a lot in person so far, I think that we have a pretty good list of things that we want to accomplish there.
And one thing that we actually have coming up for anybody that might be interested is, although our reoccurring monthly meetings are typically the first Thursday of the month, we're actually having a meeting next Thursday. It's an odd time, Heather, I think it's 9:30 to 10:30, where we'll have a guest speaker speaking about refugee health. And like Heather mentioned, we've been having some transitions. So the email on our slide deck here to the HPV email will come directly to us, or Heather can put in a Gmail, or I can put in my email. And then eventually the task force webpage will be updated as well.
There's a question from Paula in the chat regarding the difference in incidence rates of HPV-associated cancers in men and women. I can't speak to that directly, but in regards to the vaccination rates, I can tell you that based on the NIS teen data, which is the National Teen Surveillance Data System that we use at the health department to track, the 2019 data has females ages 13 to 17 who are up to date with their vaccine at 70%, and 56.9% of males. So they are lagging behind, but they are catching up.
Yeah, and Becky, it sounds like, so Paula, to answer your question, so what is the difference in incident rates of HPV-associated cancers in men versus women? So a little bit on that, we are seeing that oral pharyngeal cancer in men is surpassing cervical cancer, and one reason for that is we don't have a test to test for oral cancer yet. That would be really awesome, groundbreaking science that people could really get going up for us. But that you see these differences because there's different types of cancer. Like oral cancer affects men more than it affects women. There's some mucosal involvement in that. And then, yeah, Becky kind of answered the last part of your question. We are hoping for equal importance in male and females. Females are going to have higher rates thus far, is because we started vaccinating them first. We just added boys in 2009, 2010 onto the routinely recommended schedule. And you really saw the really big decrease in, I mean, this is just recalling from a slide I have in my HPV 101 slide deck. At Denver Public Health, it was like, we gave it to girls. We saw all these genital warts cases go down in girls, but they still kept going up in guys. We started recommending it for girls. Boom. So know that it works. Thanks, Becky, for putting that NIS teen data. And that's an estimated percentage, it's a survey. So take that. Yeah, so take that data for what it's worth. I would really, SIF has some nice dashboard, or Colorado has some decent dashboards, and Denver Public Health too. If you just visit Denver Public Health or Google Denver Public Health and HPV, right before I left, we were working on some really robust data visualization stuff for our HPV data, and it's supposed to like update automatically. I know there's a lot going on with COVID, but if you check that out, you can find some really good Denver data. And then I know CDPHE has really great Tableau dashboards, so that I'm jealous I can't play with.
Heather, you want to explain a little bit more about the HPV Free Alliance and the partnership with the task force, a little bit about how that's worked together?
Yeah, so we really work together. I mean, and I think that now I really wish Tiffany would have hopped on today. I don't know if she was even at any of the Cancer Coalition stuff today, but Tiffany Girard is the HPV HPV Alliance for HPV Free Colorado program coordinator. She was my former supervisor, and she would be really good contact for you guys moving forward, just because I don't unfortunately work in that position anymore, but I still am very, very good friends with all of these people. I see them on a weekly basis still. But anyway, so the task force and the Cancer Coalition, or the task force and the Alliance work together, where we work in certain counties of Colorado, and the task force is more statewide. And so Jenny and I are really hoping to fill those gaps of where maybe the Alliance just doesn't go. Like, I know like El Paso County is one of them. There are counties that have vaccination rates that are low that unfortunately have really high hesitancy thoughts rates, if you will. So there's still a lot of work to do around in parts where you don't think that there are, like Douglas County, we've seen a little bit of an increase, but they really have a lot of work to do there, and that's just down the street, So I think we really are trying to work together, but complement each other, so we're not stepping on each other's toes. They have a full-fledged grant work groups and everything. And I think Jenny and I are just trying to think of things that could kind of fit in, like tapping into maybe educating pharmacists. We don't do that at the Alliance. I don't know, Jenny, any other thoughts? I know there's been a lot of response on our survey about interest in the oral health, which is really great because I think that now that the prevention of oral cancer is on the label for the HPV vaccine, it's just gonna make it more easier for us to do these interventions for this type of cancer. I feel like I'm just kind of rambling on. Anything else from anybody? I could talk about HPV all day. I really miss it.
Heather, can I ask you or Jenny a question? About 3 years ago, I was supposed to be a patient advocate on a research project where Dr. Anthony Jimeno and Dr. Wang at UC Cancer Center or CU Cancer Center were the PIs for this SPORE grant project, which included an adult HPV vaccine for a research project. They didn't get the SPORE, but I don't know what's gone. I don't know of any more about the research that may have gone with it. Have you heard anything about it?
You know, that's a great question. I'm not sure exactly that particular research study, but maybe they were looking at the age between 27 and 45 cohort. Maybe they were testing it because I know recently that's another announcement, if you don't already know, that the FDA and ACIP have now said that we can go ahead and give the HPV vaccination to males and females between 27 and 45 now. So my dog's gonna bark, hold on one second. Sorry. But I'm not sure about that particular, I would love to know more information. I'm not sure about that particular, sorry.
And Tommy, yeah, that's all that I was going to say, what Heather had said as far as the age range, and maybe that could be something connected to it. But there's definitely a lot of places where we could still, use a lot of research. I think that, one thing Heather had mentioned with not really having the ability to screen for oral cancers and oral cancers happening later in life, the necessity to really talk about prevention and being able to really increase our vaccine rates and look at Colorado as a whole, yes, but also look at what do communities need in order to really help out when it comes to preventing HPV cancers.
Right. I see Dr. Jimeno next month, so I'll query as to where they are with that research at this time.
That would be great. Yeah, I mean, anything you can find out, I'm sure. I'll speak for Heather. I'm sure she'd be interested in knowing it too, and I definitely would.
This is Carlin with the Survivorship Task Force, and I would love to hear your refugee talk. We're trying to figure out how to talk about health disparities and social determinants of health and all of these complex issues. So I don't know, and I'm sorry to even ask Christy and Becky, but I don't know how we can kind of share some of these educational sessions with others, because that may be a great way to help us during this weird time.
Yeah, don't be sorry to ask. Just keep reminding me if things need to be sent out.
Something too, and Carlin, if you want, I can even send you an invite to our task force meeting next week, but something that Heather and I kind of uncovered in our survey to task force members about what educational needs there are. One component that came through was the opportunity to record and then share those out. And I think that's on our radar to talk with Christy and the Cancer Coalition about, if we're able to record these and our presenters are okay with it, can we share this out through the Cancer Coalition for other task force members that might be interested but maybe aren't as active on the HPV task force. And I know I had said it's kind of a weird time of day next week, but if you'd like to chat me your email address, I can certainly add you to next week. And if it works out, great. And we're hoping to record it. We haven't confirmed it with the presenter yet, but if there's an interest, we can always have opportunities to, invite them again too.
No, that would be great, because we're hoping to do something on housing insecurity at the end of the month. So There's so many topics, and I'll email you now. Thank you.
And Jenny, if the presenter is okay with it, what I do normally is take the download from Zoom and put it into YouTube, and then we can put it up on the task force webpage. So Survivorship actually has a few videos from their guest speakers on their task force page.
That's great. Thank you.
Yeah, thank you for that. That'll be great.
Any other final questions or thoughts for the HPV vaccination task force? Thank you, Jenny and Heather, for jumping in and doing some strategic planning to figure out where to go next.
No problem. Thank you. Thank you guys for your support, and have a great rest of the day.
Yeah, thank you all for the opportunity to talk and be a part of the symposium this year.
Yes, thank you. These meet and greets are working out. I'm glad that people are sticking around to engage. So